to divide. So we're looking at this colored representation. Here we are, right up here. So at the model that you were just looking at, you got your hyoid bone, your thyroid cartilage, your cricoid. Here's your tracheal cartilage. Even in the back, you have your arytenoid cartilage back there. You don't have, you got your little epiglottis. Look at that. Okay? And here we're down into our trachea. And then the trachea runs a couple inches, and then it's going to start to branch. Okay?
That was so fast.
That was fast?
Yeah.
Well, we just did them all. So that was called a review. That was a review for your exam.
So can you just review it one more time?
No. Then it's going to branch into two main branches. Okay? Go back up to the front.
You want ours?
Yo, Sam, what you doing? You want
Well, you have to give it back.
I like that one, right?
You have to learn to share. Trachea, tracheal cartilage.
That one was colorful.
Branches are called primary bronchi. How many primary bronchi are there? Two. One for the
Primary?
left, right.
Primary.
Correct. Easy to see and identify on many of our things. So you could also be looking at your lung models. If you don't have the tree, you could be looking here at your lung models.
We did a trio.
Okay? You can see
Grab
the
that long one.
trachea. Behind it, you can see the squamous esophagus, the vertebrae. You can see the two bronchi. And they branch for the right and left lungs. The other thing that you can see if you have them, the covers, you want to get the covers if you don't have them. The covers for the lungs. You can also see they made it nice by putting lines for you. You can see that there is a slight difference between the right and left lung. The right lung has 1, 2, 3 sections to it. The left lung has only 2 sections to it. Okay, so the main lung, and we'll see pictures of the lung in a bit. The lung is the main structure, and then it's broken down into smaller and smaller and smaller compartments. The right is broken into 3 smaller compartments, the left into 2 smaller compartments, and that has to do with the next set of branches. Right, the next set of branches. The right, having 3 sections, is going to need to have 1, 2, I guess 3. I'm not loving the picture. 1, 2, 3 secondary bronchi, which are going to go to the 3 subsections of the lung. And the left, having 2 sections, should have 2 secondary bronchi, and I don't know, 1, 2?
3.
You probably had it.
It's hard, I know. Can't, not in love with it. How's that tree here? Let's see how the tree goes. What came back to you guys?
Yeah.
You were crying?
Yeah.
Okay, so here's our left and our right. Here's our primary on the left. And here's a 1 and 2 secondaries.
Tilt it this way.
Okay? Here's our right. Here's our primary on the right. Here's 1. 2. And maybe 3 secondaries on the right. Okay, so the third secondary is coming on. See over here, there isn't one up top here. See, it's a nice straight course without one coming up. And then it branches into 2. Well, here's the third coming right off of there, right up there. And then there's 2 branches down below, 2 branches down below. So there's that oddball, the third. So primary, secondary, and then our lung models don't show it, but then these main lobes, as they're called, 3 and 2, are then further broken down into smaller sections, lobules and the like. And the book probably goes through the breakdown, but then there are small branches off of the secondary that then go to the smaller compartments of the lung. So now we go then to the tertiary. The tertiary, and this doesn't have it, but then you can start to see them though. You see these little guys here, and these little guys here, and you see these little guys coming up. Those become what's called the tertiary bronchi.
So these would be little tertiary.
Correct. Now, if you're going to go to extra help, if you're going to talk to other people, you know, there's still not complete consistency. Okay? If this main thing here that I have my fingers on, that's a secondary, you look at that, you're going to see a little white, 1, 2, I see 3 white branches coming off of that. That would be the tertiary. And then coming off of those white branches are all these colored branches. All these individual colored branches, tertiary, the ends of these branches? No, that's another branch off of the tertiary. Theoretically, if you look at it, you'll see the little white branch, and then the colored part stuck to it. There's, you know, the colored part extends off of that. There's a little colored part that's still part of that branch, but these little individual fingers coming off of that, that's a 4th branch. That's a 4th branch, which we'll see in the next picture, I hope. Oh, well, before we get to that picture, here it shows you the lungs. Right lung has 3 lobes to it. Left lung has 2. They both have a superior towards the top. They both have an inferior towards the bottom. The right has a middle. Each one has its own secondary bronchi. 3 secondary, 2 secondary. Here's the, looking on the underside of the lung. You see the lobes. Okay. Here, where the vessels, blood vessels, pulmonary artery, pulmonary veins, where the bronchi enter into the lung, this whole area is known as the hilus or the hilum. That whole area where the things enter in and out, it's called the hilus or the hilum. Notice between the lobes you have these lines, the grooves that separate the superior from the inferior. The groove that separates superior from inferior is called the oblique fissure. Both lungs have an oblique fissure. The groove that separates the middle from the superior is called the horizontal fissure. The horizontal fissure is found only on the right. Horizontal on the right. Yes.
The hilum is the group of
The opening.
Oh, the opening.
Opening into the lung is the hilum. What's going in and out of the hilum? Pulmonary artery, pulmonary veins, and your secondary bronchi.
Opening is called a
Correct.
Vessels.
Right.
Would you mind that on the test?
Could I have it on the test? If I put it on the test, I'd have to do something like this. Right? You look at this model, and you see this area right here where you have the bronchi going in, you got the vessels. If I said, what is the name of this region, opening? Hilum.
Got it.
Where is the base of the lung? Base. The base rests on top of the diaphragm. Where's the apex of the lung? The top. You can, if you push deep enough right in here behind your clavicle, push deep enough down, you can almost touch the apex of your lung. I feel it.